Sometimes children struggle with mental illness. It can happen. But how can we as parents tell if our child has a mental illness, and what should we do? There's so many questions that concerned parents have. You are definitely not alone. We are going to try and answer some of your questions right now.
My child seems to be struggling. Could it be a mental illness?
It might be, but there could be many other things causing your child to struggle. If you feel your child struggling in school, with friends, or at home, or if you feel like he is having difficulty thinking clearly, coping with life, struggling to fit in, just getting through the day, don't hesitate to seek out assistance from a mental health professional. If it is a mental health condition, the sooner it is recognized and your child is treated, the healthier and happier your child will be.
Why is my child behaving badly?
If your child is struggling with a mental illness, what you are seeing may not be bad behavior. You are most likely seeing her respond to symptoms that she is experiencing. Depending on the specific mental health issue, she may be struggling with depression, anxiety, strong urges, or confused or distorted thoughts. Often the behaviors you see are actually attempts to overcome, quiet, or compensate for the symptoms. Your child may be argumentative or resistant. She may avoid interaction or responsibility. She may cry or become angry, maybe even destructive. She may turn to drugs or alcohol. She may not pay attention in school, or her grades may be suffering. Or she may just seem distant. At these times, it is important to try and understand what she is experiencing, even if you're not sure, even if you don't know exactly what she is thinking, even if you don't agree with what she's saying or doing. If she is struggling with a mental illness, her brain is sending her signals that result in symptoms. These symptoms can result in behaviors she uses to try and cope with her symptoms. Understanding this is the first step in helping your child overcome her symptoms, reduce these behaviors, and live a successful life.
Did I cause this to happen?
While certain symptoms can result from severe trauma, like abuse or neglect, if you have not been the source of these kinds of acts, you are not responsible for the mental illness being experienced by your child. It's important to realize that there is a genetic component to most mental illnesses, which you have no way of controlling. There are also environmental factors such as stressors or traumatic events that may not be occurring at home. These can sometimes lead to mental health struggles, but they are not your fault.
I have heard that mental illnesses are not real, that people use this as an excuse for just not trying hard enough. Is that true?
Absolutely not. Mental illnesses are real brain diseases. This is supported by volumes of scientific research.
My child needs help. What should I do first?
Once you become aware that your child appears to be struggling and you think it may be some kind of mental health condition, the most important thing to do is to seek out the help of a mental health professional and educate yourself about your child's condition as soon as possible.
Who do I go to for help?
You may contact any community mental health provider, talk with a school counselor or nurse, or go to a local hospital, or talk to your own physician. They will be able to guide you to area mental health professionals. There are also many websites that provide a great deal of information regarding mental illnesses, but be sure that the source is reputable. Your local mental health providers can guide you to such websites.
If I seek out help for my child and he starts some kind of treatment, will it condemn him to a life on medications and not being able to work, or to have relationships, or to live a normal life?
In cases where a person has a mental illness, there are no absolutes, but with treatment, anything is possible. Treatment is your absolute best chance of minimizing the impact of a mental illness on your child. Without treatment, symptoms often become worse and harder to treat. The sooner help is provided, the better chance your child has of living a full life.
My child just lies around all day. He doesn't help around the house. He gets angry when we ask him to do anything at all. I don't want to add to his stress, but I also don't want to see him just lie around all day. To make things worse, we are all walking on eggshells all the time so we do not upset him. What expectation should I have of my child?
This is a very common question. This issue may cause stress between family members when they disagree about what is going on with the child and how to respond to the behaviors. Therefore, it is best to talk with a mental health professional who can help guide you and also who can work with your child. The key is to make sure that all family members understand your child's illness and symptoms, and come to an agreement with what expectations are realistic and reasonable. Then determine what your approach and response will be if your ill son or daughter does not meet your expectations. Again, utilize your mental health professional to help guide you and also to help reduce the stress that family members can feel in these situations.
How do I explain what is happening to my ill child?
The primary message should be one of love and support. Let your child know that you can see that she is struggling and that you love her and are there for her. Explain that getting help will reduce her pain and the discomfort she is feeling. You can also seek out the help of a professional who is trained to explain the illnesses to those who have them.
What do I tell my other children about what is happening to their sibling?
It would be our suggestion that you sit down with your other children all together and explain that their sibling has a mental illness. Then explain to them what mental illnesses are, that they are real, and what it means to have one. Identify some of the behaviors they are apt to observe and agree together how you will all respond to them. Again, there are professionals who are well equipped to assist in these conversations. It is also important that you keep things as normal as possible for your other kids. Since your ill child is likely to take a lot of your time and attention, it is critical that you carve out truly quality time specifically for your other children.
What do I tell our friends?
You are under no obligations to tell your friends anything, although there is no shame in having a child with a mental disorder. 1 in 5 people have some kind of mental disorder, and chances are that your friends or their families have been touched by a mental disorder as well. The fact that your child has a mental illness is not a death sentence and does not mean that your child cannot live a full life. The key is to get help as soon as possible. There is help for your child, and there is help for you.